Two.
Hello, I'm speaking to you from outside Frome Community Hospital, where we've just had the board meeting for September. This is the regular board podcast, and an opportunity for me to update you regarding some of the key issues we discussed as a board. Our meeting began with a patient story, and I was really pleased that we were able to feature the story of a young mum who's got two young children and has had mental health problems and other health difficulties, and therefore required a lot of support from our services, particularly our health visitor services. And she spoke extremely positively about the support she'd received, but also about some of the challenges she encountered, particularly in relation to accessing mental health care. I think it's important for the board members to hear firsthand from our patients and service users regarding what's gone right and also what's gone wrong, so we can learn and hopefully go to some way to improve the services we provide. This month's board meeting was the last board meeting that Sue Balcom will attend. As you are no doubt already aware, Sue will be retiring from the Trust at the end of this month. So obviously we took the opportunity to thank her for her 38 years service to the NHS and all she's done leading nursing across the county of Somerset. In terms of performance issues, we received an update regarding the reopening of stroke beds at Willerton Hospital. We're really pleased that we've been able to open the 6 beds which were temporarily closed last year. To do this, we've had to temporarily close the community beds at Dean Barton Hospital. And the reason for this, quite simply, is that we do not have enough staff, particularly trained nurses, to go around at present, and therefore we want to consolidate the nurses we do have at Willerton to reopen the stroke beds. Delayed transfers of care remains a challenge for us. We've seen in the last month a slight increase in the number of patients who are in our community hospitals but are fit to be discharged. This is something that we really need to address going forward, particularly with winter around the corner. And I know that the problems that we're encountering are also shared by Yeovil District Hospital and Taunton Somerset. We've seen a slight increase in the number of colleagues who have work-related stress and anxiety to the extent that they cannot come to work. This is a real concern for us for obvious reasons. One of the things I'm very keen to do is to look at whether it is directly related to staffing and see whether we have peaks in work-related stress in those services and hospitals where staffing is most problematic. And linked to this, obviously, is the issue of agency spend. We continue to spend a fair amount of money on agency nurses and also agency doctors. Indeed, just under 50% of the spend is on doctors rather than nurses, which is an awful lot when you think about the numbers involved. With that in mind, I'm really pleased that this month has seen a number of new medical colleagues join the organisation as a consequence of some concerted recruitment activity. So that should go quite some way to reducing the amount we're spending on agency doctors and also help us to improve the quality of care that we're providing. During the board meeting, we received the updated smoke-free policy for the Trust. This is a really important document because, as you will know, we will become a smoke-free organisation as of the 1st of January next year. This will be quite a challenge, and I'm aware that some colleagues are quite concerned about this and how we will implement becoming smoke-free. What I would say is that we are not the first organisation to do this. Indeed, we are one of the last community and mental health trusts to go down this route, which is now national policy. So it's something we must do, and I am very confident that due to a lot of hard work by a number of colleagues, we will be well prepared to ensure that we successfully become a smoke-free organisation. And finally, we received a very detailed update regarding implementing the IMNT strategy. IMNT is something that we often neglect to focus on, but plays a really important role in helping us ensure that we provide the best possible care we can to those who use our services. We have a very small IMNT team compared to many organisations, but they certainly punch well above their weight. And an example of that is the fact that over the last 12 months, 700 community staff have been equipped with smartphones, which allows them to work far more effectively and efficiently when they're away from their base. The other thing that we've seen over the last 12 months is the appointment of the Trust's first clinical information officer, Demelza Douglas, who is a paediatric occupational therapist, and I'm sure that she's helping link clinical staff more effectively with the IMNT team and ensure that what we're doing in terms of developing IMNT enables colleagues to work better and deliver better care. So that's it from me, apart from saying this will be my final board meeting.